Performance-enhancing drugs can not only cause an athlete their career, but it can also take their life. There are more negative effects than there are positive effects in using these drugs. The negative effects can cause harm to your body and mind as well as harming your career. Today, I plan to tell you about the effects performance-enhancing drugs can have on you physically as well as emotionally. I am talking about a few different types of PEDs that particularly interest me. The reason this specific topic interested me so much is because I've always been an athlete, and seeing the way people can throw their careers away completely surprises me. When someone loves a sport so much, I don't understand how they can ruin what they have worked for their whole life. Now, I will tell you about a few different types of performance-enhancing drugs and the effects they have on you. I found many interesting facts on the different substances that athletes use to try and increase their abilities. An anabolic steroid is defined as synthetic steroid hormone that resembles testosterone in promoting the growth of muscle. Such hormones are used medicinally to treat some forms of weight loss and illegally by some athletes to enhance physical performance. The androgenic effects of testosterone are development of sexual characteristics such as facial hair growth and the development of prostate gland. The anabolic effects of testosterone are an increase in muscular and skeletal strength, enlargement of the larynx, and development of the libido. Some psychological, dermatologic, cardiovascular, and unhealthy side effects of steroids are live tumors, cancer, high blood pressure, severe acne, infertility, baldness, insomnia, mood swings, breast development for males, growth of facial hair for women, and premature closure of growth plate for adolescents. Ephedrine is defined as an illegal substance that is commonly used by athletes to stimulate weight loss by subduing the appetite with the goal of improving athlete performance. Ephedrine is used as a prescription medication to treat breathing disorders, nasal congestion, low blood pressure, and even narcolepsy in some serious cases. Some serious side effects that can be caused from taking ephedrine as a performance-enhancing drug can be rapid heart rate, heart arrhythmia, increased blood pressure, tremors, as well as possible heart attacks, strokes, death, seizures, or psychosis. All of these effects of using ephedrine can be heightened when the use of caffeine can be taken with the stimulant. Androstenedione is a steroid hormone. It is used to make medicine, and it is also used to increase the production of the hormone testosterone to enhance athletic performance, increase energy, keep red blood cells healthy, and enhance recovery and growth from exercise. Some androgenic and estrogenic effects of androstenedione are excessive hairiness on the face and trunk, weight gain, loss of female body contour, testicular atrophy, obstructive sleep apnea, liver disease, and increased aggressiveness. Recognizing steroid usage early can help to prevent an athlete from suffering the adverse effects and from decreasing the chance of athletes using steroids. Some effects of steroids usually that are recognizable can be rapid weight gain, mood swings, yellow coloring of eyes or skin, deepening of the voice in females, significant muscular growth, and premature maturation in adolescent males. Many student athletes will most likely not willingly admit to using any steroids because of their illegal and immoral nature. Thus, when a coach or person approaches an athlete who is under notion, research shows that you should be knowledgeable rather than judgmental. When asking a student athlete if they have been using performance aids, start by asking if they know anyone who has been using these enhancers. You may then ask if they have been using because it won't come off in such a serious way. The use of performance-enhancing drugs in athletes at every age is widespread and growing. All of the substances I have named, as well as many others, have some hostile side effects, whereas some are more severe or life-threatening than others. It is still brutally important that these effects are discussed worldwide among young athletes so that they may know the worst that can happen from using these simply because they want to be bigger, faster, or stronger. In my research, I found an article by Hinkle Smith and Shelby L. I came upon a statement that said, "It is easy for coaches and administrators to say, that doesn't happen here when it comes to a discussion on student-athlete performance-enhancing drug supplement use. I agree with this statement entirely. Most administrators or coaches would say that they know their players and that none of their players would ever consider this. However, it is very easy to be completely unaware of when someone is using performance-enhancing drugs until you start to look for recognizable effects that I stated earlier. I will end my speech with a quote from Pelé, a professional soccer player from Brazil, who said, "Success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do."